Hi, it's Dr. Garza. I am so sorry. I had actually been recording for the last 8 minutes and I'm not. Hi, it's Dr. Garza. I'm happy to see you today. This is my first Facebook Live Q&A, and this will be posted on my Shauna Garza MD Facebook page as well as our practice Facebook page, which is Girls to Women McKinney. I appreciate you sending me questions that relate to women's health in girls, teens, and young women. I had already started right at 12, but then didn't realize that I hadn't started the live videos. So I really appreciate your patience with my technical delay as I get a hang of this. So I'll kind of start over. I'd spoken for 8 minutes, as you can imagine, so I will start from the beginning. As far as questions go, I know these are personal topics, and so I probably will keep the questions anonymous. On Facebook Live, I do like to address people by name and know that I'm interacting with them and hearing them. But if you would like the question to be anonymous, I'm happy to respect that. So, again, these are questions probably related to your own children, teens, girls, or just like what to expect for even your girls that haven't hit some of the puberty stages we're going to talk about. The other thing is I have this scheduled until 1 p.m. and I have topics I'd like to talk about. But if I kind of get through those topics and, haven't had any other questions, I may wrap up a little bit earlier because it is a lot of time to fill. So the topics I'm going to review today and hopefully, offer some guidance and good education is I'm going to talk about puberty. I'm going to talk about periods. I'm going to talk about PCOS, which is polycystic ovarian syndrome, also birth control and vaginitis, which are vaginal infections and concerns that patients bring to my office and to visits with me. So those are the topics that I'd like to be able to go over. And, please reach out and comment on, if you've learned something new or anything you'd like clarification on. And again, this is my first live Q&A, and so I am going to do my best to answer questions in real time and comment back in real time. But again, of course, this is a one-woman show today, so okay, so getting back to what I'd already reviewed on my first go round and is puberty. So puberty is obviously a normal developmental process. And in boys, the stages of puberty are less apparent and maybe more subtle. And so, there's kind of gradual changes to their body that we note. But with girls, there are more defined stages, and that really relates to the start of periods. And so, when puberty starts, the first sign of puberty in girls is the formation of breast buds, which are the first stage of breast development. And to let you know, on average, girls start their periods about 2 years after breast buds form. So that's just kind of a ballpark for families to be aware of. And then during those 2 years, the breast continues to develop, and we stage that, the stages of puberty. Also, hair starts to form in the armpits and pubic area. There can be changes to at skin with acne, increased sweating or body odor, needing to start wearing deodorant. And those are all very normal changes. And so we do reassurance of that, of what to expect and what's normal. Then when periods start, that obviously is a normal stage. We call that menarche, and menarche has a very wide age range. And so it's interesting. What's considered normal at this time is periods starting between the age of 9 and 16. So before 9, it's what's called precocious puberty, which is periods starting before 9. And then by 15, if girls haven't started or haven't started having any type of vaginal changes, then we will be looking at labs and maybe a sonogram or even an endocrinology referral to kind of get at maybe other underlying causes of delayed puberty. But a normal range could be a 9-year-old who could be a third or fourth grader, up to a 15, 16-year-old, which would be, maybe a sophomore in high school. And that is a wide age range of development. And so, many girls will come in with questions about what to expect and when they're going to start and when this is all going to happen, because they see their friends going through these changes in development. And, I have to reassure them everybody's on a different pace with their growth, and that's normal. Some of it's genetic, some of it has to do with their other growth patterns as far as height and weight go. And it's something they don't really have a lot of control over. So it's really just understanding that their body is unique, it is theirs, and it will, grow and develop normally on its own time. So when puberty starts, we then reassure them, and many girls do not have a regular cycle when it starts. Girls will have some irregularity, and that really has to do with puberty being a process. That's a phrase I use a lot, excuse me. And so puberty as a process means that when your period starts, it's not like some light switch gets turned on and it's on or off. It really is one point in time of growth and development that continues to progress. And so, they're getting signals from their brain that are triggering their ovaries to start ovulating, and that doesn't happen at a perfectly mature, way. And so there are delays in that. There's still growth to happen, and that means that girls will not have a period every month. And we reassure them that's very normal, and that can even go on for the first couple of years after their cycles start. And so they will have maybe periods every 6 weeks, 7 weeks, that type of thing. Where we worry is if they're going more than 3 months between their periods starting, that can be something we need to look at. And then where we get pulled in with, irregular cycle at the beginning, often is when girls are having periods too often, where they're lasting too long, they're occurring twice a month, and it's very disruptive and hard to manage for them. So some of our evaluation is reassurance and guidance. And that's a lot of the work I do is education and guidance. But many patients will come to us with period related problems. And what period related problems mean for us are symptoms that are disruptive to patients, where they're missing school, missing activities, and having, just a lot of distress in managing their periods. It also can mean that they're having anemia related to heavy flow. And so we get concerned about heavy flow. We get concerned about periods that last too long, that are coming too often, and then cramping. Cramping is a big symptom that I talk about, and that can even be associated with nausea. And patients miss school. I've had patients that were missing a few days each month of school and having even truancy and absentee problems because of it. So this is really affecting young girls. So we go into an evaluation of history, of course, of like how the period's been, what they're having, what they're dealing with. And then our evaluation often will look at lab work. And so on lab work, we are looking at other things that could be, affecting their cycle, other hormonal imbalances, thyroid function, for example. And then we always want to screen patients for anemia and iron deficiency, because that can really affect how they feel. We know anemia can affect your focus, it can affect your energy, you can feel winded and overly fatigued, and all of those things can limit activities in our young girls and teens. So, and that's kind of the, approach we have. And then, I'll get into next about how we treat those period related problems. But those are the types of things that we address in our practice very frequently. So sometimes patients will find us directly because we focus on the care of young women and young men, of course, in this practice in McKinney. And then we'll also get referrals from pediatricians. Many pediatricians don't, necessarily have the time to manage period issues. And so they'll refer to us directly to manage those concerns. And so I work with pediatricians in the area in both Allen and McKinney and Frisco in order to kind of partner with them, because we can provide that care, and patients can decide to continue with their pediatricians for other care, but we step in with our expertise on menstrual health and women's health. And so that's a big role that I have. And those partnerships I'm continuing to build as I establish my practice here in McKinney. Um, Okay, so another kind of period concern can be, irregular cycles. So, let's kind of move forward. Say someone started their period and they've never had a regular cycle. Maybe it's a 16-year-old that's had it for a few years, but their periods are very irregular, where they're having maybe, 2 or 3 periods per year, and there's concern for that. And so I will often look at other things in their history or on their physical exam to identify PCOS. PCOS, which is polycystic ovarian syndrome, is a condition that can cause irregular periods. It is a hormonal imbalance. And we don't know why patients have it. It may be genetic, but it's also associated with other conditions. And so, it can lead to just other things that need to be addressed. So PCOS means that patients can have multiple cysts on their ovaries, and that's affecting how the ovary is functioning. And so what happens is the ovary is making too many male-related hormones. We as women have testosterone as part of our hormonal balance, and in PCOS we have excess, too much testosterone or other male related hormones, and that is what's causing the symptoms of PCOS. And so that is a regular cycle. Girls are not ovulating on a regular cycle, and then it can cause skin concerns with acne, with what's called hirsutism, which is abnormal hair growth, along the chin or on the face or on the upper lip, even sometimes on the chest. It can also cause darkening patches of skin that we'll notice on the neck or in other skin folds. And what we are worried about with PCOS is this hormonal imbalance can have other effects in the body, affecting other systems, and is associated with diabetes. It also can be associated with cholesterol abnormalities. And so, we want to screen patients and identify them early and get them on treatment to really help prevent those associations, and also, of course, improve that hormonal balance. So the way I evaluate is I examine, I talk to them, and then labs are very important. Labs help us see those hormonal imbalances that can identify PCOS. And then sometimes we'll do a pelvic sonogram, and that is to look at the ovaries, but it is not necessary to make the diagnosis when we see labs that indicate that. So the main treatment of PCOS are with hormones and with birth control, and I'm going to talk about that today. And so birth control, I guess I'll just move on to that, is birth control is something that we use a lot in our practice to treat the period related problems, to treat PCOS, to treat acne, to treat other skin conditions. I have patients that have an autoimmune skin condition called hidradenitis, and it helps that. There are a lot of medical reasons to use birth control. And so a lot of times when I'm educating families about that, I'll talk to them and say, this is a hormonal treatment. We know we're not using it to prevent pregnancy. The medications were designed to prevent pregnancy, but they're not ones that, our use in our practice, I would say 80 to 90% of the time is not for pregnancy prevention, but more for treating other medical conditions. So I just wanted to show you, we have lots of great educational handouts in our practice. And so, this is something that's real typical that I'll go over with a patient, and it talks about the medical uses of birth control, of hormones. And so, it's to treat period problems, shortening periods, decreasing the flow, helping treat cramps, making the period more predictable. Those are all really positive things that could help keep kids at school and their activities and not, having the level of distress that they're having with those symptoms. The other thing is, again, it can treat skin conditions, acne, the hirsutism, the other glandular problem, PCOS. Some girls will have recurrent ovarian cyst on their own, not related to PCOS, and it helps prevent and treat that. I have patients that have what's called menstrual migraine. They get an actual migraine headache at the time of their period or before their period, and that can also be treated with birth control. And so those are, this is a lot of the work I do day to day. And then, we also promote it as a way to treat anemia because we know that when we see anemia and iron deficiency in teen girls, it's, mostly predominantly caused by heavy periods. Now, there may be patients that have low iron intake, but to have actual anemia from iron deficiency typically is from having heavy periods and actually losing, more blood than they should, where they are losing iron and that's causing anemia. So the main treatment for iron deficiency anemia, of course, is iron supplementation, but it's also getting the periods under control because otherwise it becomes a chronic problem instead of something that we can treat and improve. So that is, part of our goal with treatment. And then, I don't want to overwhelm anyone, but we have very open discussions in our practice. And so I do have this handout that goes over all the different forms that hormones come in. And so I will sit down with a patient and, usually a parent, and kind of go line by line for them to understand what options there are. And, really a lot of the medicines are similar, but they're delivered in different ways, meaning there may be a pill that you take, there may be a patch you can use, there's a NuvaRing, there are longer acting options that are, IUDs, or we perform the Nexplanon, which is the rod that's inserted into the arm. So there are lots of different options of how the hormone can be delivered to your body. And so that is something that we review. And I will give recommendations, but I always want my patients and families to feel comfortable with what we're deciding on. And my approach as a physician, especially in adolescent medicine, is always to approach medical decisions in a shared way. And so with teens that are 16, 17, and starting to make more choices for themselves, I want them to feel like they're part of that decision and they feel informed and ready to make, just be empowered to make those choices for themselves. Now, one thing I have a little piece on here that I go over with every patient, especially ones that do have boyfriends and are older, is that if the birth control is being used in addition to period problems, but say to prevent pregnancy, I, talk to them very pointedly about condom use because I don't want patients to have a false sense of security with the use of hormones because they have no role in preventing sexually transmitted infections and only condoms can. And so we talk to them about how important that is and that every single sexual encounter has to be protected with a condom because some infections get passed with just minimal exposure and they don't even realize they have them. So many STDs are asymptomatic, meaning they don't cause symptoms, and so they can be spread without anyone really knowing. And the condom is really the only way to prevent that spread. And so, we have very direct conversations about that. And sometimes that's in private with me and the patient, and sometimes that's with the parent there too, because I want them to, feel comfortable to open up that communication with their parent so they can get the support they need, and reminding teens that their parents are on their team. Okay, one other piece that I wanted to just quickly talk about is skipping periods on birth control. And skipping periods on birth control can be for different reasons. And so it can be to prevent the flare of other medical conditions associated with their periods. Menstrual migraine is one of those I mentioned. And so, patients are having migraines, we'll actually have them skip their periods, so to help prevent that. The other can be, I see a lot of patients for mental health, and so sometimes it's related to mood and severe PMS, or what's called PMDD. It's a depressive disorder during the period, and so we want to skip periods. It can help patients feel better. So there are ways to manipulate the cycle when you're on hormonal treatment, and that is safe to do. And so some patients will skip every period and will work towards that. Some will skip periods related to their sport. Say they have a big soccer tournament and they don't want to have their period that weekend. We can walk them through that. Others will just delay their cycle, where they'll have a period every few months, and feel like that's a more manageable way to have their periods. So those are lots of options that patients can have depending on what form of birth control they're on, that can help them skip periods. And again, we just reassure patients it's safe to do. It's very different than if someone comes to me and said, I haven't had a period for 3 or 4 months. I'd say, okay, we need to evaluate why. But if you're taking hormones, you're suppressing things, and it's a safe option for patients. Okay. So I have talked through a lot. So I think the one last thing I will talk about that we see often are vaginal concerns. And so there are concerns for vaginal infections, irritation, inflammation, and some of that can relate to hygiene. When girls start their periods, they sometimes may struggle with how to kind of use pads and tampons and understand how to kind of prevent infection. And so we go through that guidance. And then we also will talk to them about potential infections. And so that's something that is very hard to do in a telemedicine format. Usually I need to see patients in the office because I'll need to actually do an exam. But causes of vaginal infection that are common, of course, are yeast infections. There's an infection called bacterial vaginosis, which is an overgrowth of the normal bacteria that live in the vaginal area. And then with older teens or sexually active teens, we're always screening for sexually transmitted infectious causes of vaginal irritation. And so, we do an exam, we do a swab, and there's two ways the swab is processed. One is I actually have a microscope and I get to, be kind of scientific and look through the microscope at the actual swab and identify what type of infection it is. That can be helpful. And then I also send off a swab to rule out different infections. And, usually those infections are treated easily with treatment that we prescribe, and patients do well. So vaginitis is something related to infection, is something we see often. There's also vaginal irritation, where there just can be irritation on the outside, redness that's not related to infection. And some of that has to do with how patients how they're showering, how they're bathing, what types of products they're using. And so, we'll talk to them about avoiding the Bath and Body Works. A lot of teens like that the fragrances and the dyes and just even the harsh soap part um, of those products can be very irritating to the outside of the vagina, which is called the vulva. And so people get irritation there, and it's not always infection. So a lot of times it's just us guiding them and educating them on what is kind of the best way to kind of care for their vagina, let's say, and also promoting vaginal health. Um, so let me just see, I have a message here. Let me just see if it's related to this. No, it's not. Okay, so I actually haven't had any questions today, but that's okay. This was a good first run for me. I hope that you found this information helpful, and I plan to do a weekly talk most weeks as I'm available on Thursday. I may vary the time depending on, kind of when I'm available and when I think some of my followers would be interested in connecting. And next week, I plan to go over preventive care. So, as we gear up for summer, preventive care is a great thing to review because so much of our work in the summer is catching people up on their well visits and their sports physicals and their vaccinations. And so I'll go over that type of work we do next week, likely on next Thursday. So stay tuned for that. So I appreciate your views today. And as far as preventive care goes, I will post a link to that where you can send me questions or messages, and I'm happy to answer those at the live Q&A next Thursday. So any questions from between now and then, I'll save and go over at that at that session. So anyway, have a great rest of your day, and I'll see you next week.